right, next we have another panel discussion, and it's going to talk about, the panelists are going to talk about virtual assessments and lessons learned. To facilitate the next panel discussion and introduce the panelists, we have Captain Diane Kelsch. Diane is located now in San Diego and is the lead for the state of California. And she is going to be the facilitator for the next session. All yours, Diane.
Thank you, Katie. All right, so our last panel discussion for the day, we're going to talk about virtual inspections and where we go from here. So good afternoon, everyone. As we're all aware, the COVID-19 pandemic has forced us all to work a little differently. And in order to ensure food establishments continue to abide by state and local regulations, many jurisdictions throughout the country have actually implemented some form of a virtual inspection program. And so over the last year or so, you guys have most likely heard a variety of presentations on virtual inspections. However, this one's hopefully going to be a little bit different. We're going to have our three panelists each presenting similar information, but we want to talk, each of them is going to talk about a brief overview of their virtual inspection program. Then they're going to highlight some of the pros and cons that they've had with their virtual inspections. And finally, they're going to actually talk about where we go from here. So what are they finding as they go back into the field? What's the reality of virtual inspections? And then how, if at all, do they see using virtual inspections in the future? So as with all the other previous panel discussions we've had, if time permits, we're going to answer questions at the end. So we ask that if you have questions, please enter your questions in the chat box. And then in addition, if you have a particular panelist you would like to answer your question, please include their name in the chat box as well. And hopefully we'll have time to get to those at the end. So with that said, I would like to introduce our first panelist. Our first panelist is Kimberly Stryker. She is the program manager of the Alaska Food Safety and Sanitation Program with the Alaska Department of Environmental Conservation, Division of Environmental Health. Kimberly, if you want to go ahead and take.
Hey, I think Kim is having internet issues. Do we want to switch to somebody else first?
Okay. We can move on to our second panelist, and that is Teresa Hayes. Teresa is with the Environmental Health. Teresa is the Environmental Health Program Manager of the Nevada Division of Public Health and Behavioral Health, Environmental Health Section. And so, Amy, you'll have to adjust the slides to start. Thank you.
So I can move the slides forward. Okay. My name is Teresa Hayes. I'm the Environmental Health Program Manager for the Nevada Division of Public and Behavioral Health. We have always used some form of virtual inspections by way of phone calls, emails, and attestations. Because we have 11 staff covering 85,000 square miles, it has always been necessary to use, something virtual, but never that literally. At the start of the pandemic, we were using virtual inspections with a combination of state and personal equipment to reach out to operators. We were not allowed to bring state equipment home, and none of us have cell phones. So work cell phones, we were using our own personal cell phones. We had already begun our work on the disaster food safety check plan because we had recently attended ER 310 food safety issues in the event of disasters, which put us in a very good place to begin this, change over to COVID. So we changed it a little bit and added some COVID talking points, and then, moved on from there. So what we did was we created a COVID-specific unscored educational check-in sheet, which included just a brief 14 questions, which covered COVID precautions and items that we would normally check during a risk-based inspection, those 12 or 13 substantial health hazards, and additionally sharing the educational information from our NV Health Response website, which is our COVID website. We used FaceTime, we used Microsoft Teams, we used, just general telephone calls to conduct live check-ins with operators We learned early on they could be really great or really bad. It included physical effects on staff, such as headaches and in one case, vomit. So it doesn't work well for everyone. What we found is it's really difficult to get somebody to take a final cook temperature and be able to verify that. It's very time consuming to verify a thermometer, and overall staff just felt like we weren't really getting the job that we normally do. It wasn't a very good job. That's when we turned the corner and started actively seeking to be vaccinated early in the planned rollout of vaccinations. And I am proud to say that staff were totally on board with that. And by late February, we had staff back out in the field about a 100%. I'm not saying that there isn't a place for virtual inspections in the world. It's, just not, something we want to do, permanently. We do 13 counties in Nevada, not some of the major metropolitan areas. So we struggle with some of that. Overall, we provided 440 virtual inspections while still conducting on-site inspections based on risk. We conducted on-site inspections for complaints in high-risk facilities. Virtual inspections were used across all program types, not just food. We did foods, we did pools, we did hotels, we did, school questions, we did a lot of consults, we did a lot of, helping people, figure out how to change their business on the fly. Many of our facility types were closed during the early days, which made it very hard to contact some people. We have a lot of rural communities that they don't use computers, they don't have computers, they don't have FaceTime, they don't use any of those things. So it made it a little challenging. What we learned during this is that our definition of inspection was so vague that it could be anything that we say it is. But we chose the unscored inspection just so that we could keep in contact with people. The electronic issuance of an inspection report is also illegal in the state of Nevada. So for the fix, we requested the permission of the operator to send it electronically. And the future fix is that we will be requesting a change to a state statute. Future use, it's really great for consultations. I've done several myself, and you can really reach out and help somebody on the fly. It's great for clearing critical violations, and it's great for emergencies. It was difficult to keep staff on because of people's exposures and quarantines and being gone for 10 days at a time. So being able to reach out during an emergency virtually was very helpful. Next slide. So I kind of created a timeline, started 2020. At the beginning of the first quarter of 2020, we'd done one virtual inspection. And I think it didn't have anything to do with food. It was a septic. On March 18, 2020, we reached state closure. And we started to ramp up our program. In quarter two, we did 55 virtual inspections. In quarter three, 72. By quarter four, we've done 179 more. So overall, 440. Most of them were in food. We've done 339 just food inspections, and the remainder were in other program types. But it took me till January of 2021 to get phones, work cell phones for people, and we could only get 5 due to the cost. And by then we were already, pretty burned on the whole virtual thing. We really wanted to get back out into the field and, ensure we were doing a good job. In the second quarter of 2020, we only did 13 virtuals. We were mostly back in the field. And what really hit me hard was in 1 week, we closed 5 restaurants and emptied 7 walk-in refrigerators. And especially during this time, people couldn't afford to be closed, people couldn't afford to lose food, and there were a variety of reasons. And that was just a period of 5 days, back to back to back. So, I mean, that really, the light bulb came on in my hand that there's no replacement for an on-site inspection. Next slide, please. Primary restaurant issues were lack of returning staff with food safety knowledge. People couldn't, they couldn't come back for a variety of reasons, health reasons, reasons that were outside of, just returning to your basic job. Not enough staff to properly run restaurants. We have had many facilities pare down their days. Instead of running 7 days a week, they're running 5 to 6 days a week and just cutting days off and not actually operating a restaurant. Lack of funds to make repairs because they weren't open as much. People couldn't afford to, make repairs, and they were really just trying to limp along. In addition to those, we discovered supply chain issues. The inability to make a repair, especially when, the nearest part is in Reno and, we really need that part in Wells, and that's a good 6-hour drive. So the supply chain issues of being able to get those parts became a real issue. But part of what, made some of these virtual inspections so helpful is the drastic change in menus that we experienced and operational structure. Adapting to takeout and seating changes and drive-throughs. People were suddenly taking orders in the front of the building and, sending food out the back of the building because that's where the parking lot was. And so we were, actively adapting using, okay, show me on your, on your phone where you're going to set this up. And, people, actively changing their businesses to try to survive this incident. And so that was really, really helpful, and we will continue to do that in the future. But again, from our standpoint, we have a small staff. We do a lot of square miles. We have some very unusual county, dynamics. Nothing for us can replace an on-site inspection. And I have chatted with other people. We also have the Nevada Department of Agriculture and our hospital staff that all agree that we all tried this. And we all agree that, getting our staff vaccinated, keeping staff out of quarantine and keeping them out in the field was the best way to go. That's all I have.
Thank you, Teresa. Our second panelist is going to be Doug Dyer. He is the Health and Environmental Investigator 3 and a Senior Technical Lead with Public Health Seattle King County's Food and Facilities Program in Washington State.
Hi, good afternoon, everyone. I titled this "The Trials and Tribulations of Implementing a Virtual Food Safety Assessment Program" because there were trials and tribulations, so much like Teresa described. I hope to sort of elaborate a little bit from our perspective and certainly entertain questions during open discussion about the future of this. So if we could go to the next slide, please. So why did we even implement a virtual food safety assessment? Well, early in 2020, as it became pretty evident that we were undergoing a global pandemic, our King County Executive's office, based on information from our county health officer, mandated that employees in public health, and particularly our program, work from home. So only the most essential and critical employees within public health were actually going into the office. Most of us were working from home, and moreover, we weren't permitted to go into licensed food establishments or the other big program we're responsible for, which is water recreation facilities. So think pools and spas. And of course, the philosophy behind that is, we want to, as an organization, minimize the exposure risk of COVID-19 for our staff. And of course, we have staff of all different ages and health conditions. And so their personal health, of course, was paramount. And at the time, obviously, there were no vaccinations, so there really wasn't a protective factor in place for folks to go out into the field. At the same time, though, it was really important to us as a program to make sure that we had some sort of presence. So the question came up about ways we could still remain in contact with our constituents, because really we're accountable to them. Like many of you, we're a fee-supported program exclusively. So those permit fees pay for our program and the work we do. So we formed a small working group and we just started trying to figure out, was anybody doing this? And I think many of you have probably through different presentations this year discovered that South Carolina's Department of Health is probably one of the earlier health organizations that really developed and crafted doing virtual food safety assessments. So we decided to reach out to them and find out a little bit more and kind of take it and run with it. Next slide. So, we knew that we probably had a framework in place. We had our plan review team, was the earliest adopter of this, prior to us using this for sort of routine inspection type work. And so they had a pretty good degree of technical knowledge just to their own interest. And so they developed a way to do some virtual plan review type work. And this was not a replacement for in-place plan review, but again, it sort of had to be something that could fill the gap based on the executive office mandate that we couldn't be out in the field. So the plan review team started, but then what the plan review team did was they really partnered then with another work group of investigators to really take it and kind of build it out more so it could be adapted to doing more food safety inspection type work rather than physical facility verification work. And I think just on a side note, there probably is a place for this type of, certainly within plan review, and I'll get into that a little bit more during the discussion section of this. So from our plan reviewers, I think it's something they probably have been able to adapt to a little bit better. And then when we decided to sort of expand this, we knew that we had staff, inspectors, for example, that were pretty well versed as well at different technology platforms. So that might be something like, FaceTime or Skype or whatever it happens to be, but also video production. So, we've tried to leverage video production in the past as information we could put on our website just related to general food safety information, particularly in multiple languages. So just something that would be an extra tool anyways that we would use prior to ever having, undergone a pandemic and a shift in how we do our work. And then I mentioned, of course, that we had some staff that were, interested and knowledgeable about app-based communication channels. And then, just the idea of thinking about, what does an electronic report look like? Is it of value? It's something we currently do in some, or I should say had done in certain circumstances. So it's something that, of course, needed to be expanded on. And much like Teresa explained is, what are the legal ramifications? If you're not going to have someone sign a report, then, what do you do in order to make it something that's at least a legal and binding document? So we had to consult their legal team on that. Next slide. So nevertheless, there were challenges. Probably one of the biggest challenges was, and even prior to getting into this small bulleted list of challenges, I think one thing too is we have a fairly good sized program. So we have about, at the time, early 2020, had about 40 to 45 field staff and an additional 15 senior level positions. But what occurred was that field staff had the opportunity to actually go and help public health with pandemic response. So what ended up happening is we actually lost people, and we're not fully staffed anyways. And so when you license something north of 12,000 food establishments in a county of almost 3 million people, having 20 to 25 available inspectors is not enough staffing. So that's a challenge as well. And additionally, just thinking about how can you build out a virtual assessment tool that addresses two different things. So one, we have to address what we consider the biggest priorities during any inspection. That's foodborne illness risk factors. So in Washington, as you've heard earlier, that's the red section of the violations and not necessarily the blue section. The blue section is the big retail practices. And then also all the requirements that the county health officer set forth for COVID-19. So face coverings, social distancing, quarantine, isolation, making sure there's a COVID-19 plan in place, all these sort of things. So we had to develop a hybridized model that sort of took the best aspects of foodborne illness risk factors that have to do with employee hygiene and combine it with COVID-19 and make it an inspection / kind of educational assessment. So that was a challenge. That's a lot different than the type of work we're used to doing. We're used to doing work that focuses on enteric diseases. We knew we had limited time, so you have to have some sort of communication approach that engages the operator to understand behaviors, to, as I said, minimize the spread of non-foodborne complex emerging infectious disease, so COVID-19, and still be mindful of food-related diseases. We had to do something so we have a placarding system at King County, and we had to sort of devise a way to this inspection couldn't necessarily go into the calculation of the placarding system because previous to that, it was just based on normal routine inspection. So it wouldn't necessarily be fair to continue to grade someone based on this hybridized virtual model of inspecting when that has never happened before. And so we decided to suspend that. So everyone's current rating stayed in place and has stayed in place until most recently when we've actually pivoted to getting back out in the field. And then also we had to figure out for our inspection database, and we happen to use Envision, is how are we going to code these inspections so that when we do data extraction, we can make a distinction between doing this type of inspection, virtual inspection, or virtual food safety assessment, and the normal sort of inspections we did prior to COVID-19. And then finally, we have to be mindful that not everyone has access to the same technology platform. So not everyone might have a personal device in which they can, pull up Skype or FaceTime or whatever it happens to be. Next slide. Not a good slide, the font's small, but so in practice then, what we found out, so we got this going and we had a method of providing communication to operators through information on our King County food program website, basically walked operators through the entire process, had a form letter, all this sort of information about what a virtual food safety assessment is, what it focuses on, and what tools and communication equipment they would need in order to participate in it. But what we found out is when we actually tried reaching out to operators, most of them didn't think it was the health department. They thought it was a scam. So that was one challenge because, as we all know, restaurants, oftentimes have this challenge where someone calls and they're trying to extort them for one thing or another. And so that was difficult. We had oftentimes to make multiple calls to a food establishment and use email to just reassure them that it actually is the health department and we'd like to do a virtual assessment based on the current pandemic. We also found out it was kind of difficult with chronic underperformers because those are the food establishments and personnel that usually need the most help. And the best way to do that, obviously, is the traditional way, which is to be there in person, coaching, demonstrating, doing all those sorts of things to get that operator to understand what it is they need to do to minimize the risk of foodborne illness. Communications were inhibited by face coverings oftentimes, because an operator might be in a kitchen and there might be another staff member or other staff members there, and so face coverings were required. So it became difficult to understand people. Language barriers were an issue because, as I mentioned earlier, we had staff, and I mean staff that are fluent in multiple languages, off doing other temporary work to support COVID-19 response for public health. And we didn't have that person who might be fluent in that language available. So, you're trying to communicate with someone over a personal device and sometimes having to use an interpreter. And so I think that, you obviously lose that interpersonal communication that you would have if you have two people speaking the same language, and therefore you lose the intent and sort of gist of adequately doing any sort of food safety assessment. Emphasizing corrective actions through demonstration becomes really difficult when you're filtered by a piece of technology. So in other words, if an operator is struggling with even this most mundane task of setting up a 3-compartment sink properly and using a test strip to test the concentration, you're not there to actually show them that, or at least help walk them through the process. And so that was a difficulty as well. Some operators just, as I mentioned before, they don't have the technology, or they don't necessarily understand how to operate the technology. And then coverage. Sometimes people would have their phone or their tablet and they'd go into a walk-in cooler and it would drop. There was no, you couldn't get coverage. So then it was frustrating because, we had to try to get back in touch with them and continue the investigation. And then investigators weren't able to use their peripheral senses. I know for everyone on this call who's been doing this for years and years, you develop a sixth sense when you're in a retail food establishment doing inspections. We always joke that you get eyes in the back of your head, but you really sense things when you're there. And that is pretty difficult to do when you're trying to do it through a personal device. And then just the whole concept of trying to coordinate virtual inspections became really time consuming for our investigators because they're used to being spontaneous. We do unannounced inspections, and we're used to hopping in our county vehicle for the day and going out and doing inspections and not calling ahead and scheduling and all this sort of stuff, but just showing up. It's efficient to do it that way. It's not very efficient when you have to try to schedule a bunch of virtual inspections. Next slide. On the upside, operators like the opportunity to discuss COVID-19 related issues. And by this, I mean, they liked asking our investigators questions about what the county was requiring or what the state was requiring. So in that regard, it gave them an opportunity to talk to someone from a health agency about information that probably sounds complicated and certainly changes quite frequently. So that was probably one of the biggest positive feedbacks I heard from our investigators was, and operators are stressed out, as you all know, and had to pivot to different kinds of business models, particularly when indoor dining wasn't permitted. And so them having the opportunity to talk to someone from their local government, I think made a difference and kind of, in some ways, as a way to vent, but more importantly, was a way to get their questions answered. About 70% of the operators we reached out to were interested in the virtual assessment. We obviously couldn't get to everybody. We had to base it on risk category level. And for us, that would be, we have 3 risk categories, and 3 is the highest, most complex menu and processes. Some investigators thought actually you could coach key foodborne illness risk factors in a less stressful way. They thought that by not being there in person, it may be less threatening to an operator. I think the jury's still out on that one a little bit. But also, there was the benefit of when you have an operator, checking sanitizer, for example, in a test strip, or taking a thermocouple and checking temperatures, which they should be doing anyways, but having them do it, and you're there and you're seeing it, and they're demonstrating it to you, and they're letting you know what those temperatures are, showing you the concentration, I think helped probably to just reinforce those behaviors that we want them to be doing anyways, and they should be doing, certainly when it comes to active managerial control. So going forward, I think most of our staff are glad to actually be back out in the field doing what feels like more normal in-person inspections. There's still challenges, obviously. You know, we're still hitting ebbs and flows when it comes to COVID-19, certainly in our county and our state. But I think by and large, staff appreciate being out in the field. Some feel that there's a place for this at certain times. At other times, not. What those times are varies between our investigators, our plan reviewers. Certainly, this is something that they'll probably proceed with on a small scale. It's not a substitute for doing, you know, if you're going out to do a construction final, for example, they still largely feel that it's important to be there in person and walk through the kitchen and do what you need to do to make sure that at least the physical facility aspect of that food establishment is in compliance with our food code. And I don't think this is anything that, you know, will ever make up a major percentage of what we do, but at a case-by-case basis, it may have some place. I think things need to be refined a little bit when we have some time to breathe. We should probably really sit down, visit it. I don't have any data for you as far as the number of places we've done or what percentage of our total places we've done.
Ted, are you frozen? I mean, Doug, sorry. Okay, I think Doug is frozen, so we'll go ahead and move on to our final panelist. And Kim, thank you for joining us. We had some technical difficulties. As I said earlier, Kim is the program manager of the Alaska Food Safety and Sanitation Program with the Alaska Department of Environmental Conservation, Division of Environmental Health. Take it away.
Oh, thank you so much. So I apologize for my technical difficulties. I was out climbing mountains. Mountain expeditions can have varied internet capabilities, so sorry about that. Just kidding. So good afternoon. I'm Kim Stryker. I manage the Food Safety and Sanitation Program. We're within the Division of Environmental Health in the Alaska Department of Environmental Conservation. I've been a public servant for 26 years, and I've been with food safety since 1999. In 2010, I became the program manager for food safety. Before we jump into today's discussion about virtual assessments, I want to tell you a little bit about the program. And while I'm doing that, and throughout the presentation, I'll be introducing you to the amazing people who work to protect Alaskans' health. I'm immensely proud of my staff, and they don't often get to attend these types of meetings, so I thought I'd bring them to you. Next slide. Thank you. So on our plate today, we're going to talk a little bit about Alaska and some of our challenges. We're going to talk about, just give you a brief overview of what our virtual assessment looked like, what was great, what wasn't so great, and looking forward. And I'll try to hurry this up because I realize that I'm kind of at the end of the train here. Next slide. So we provide direct services everywhere in the state with the distinct exception of the municipality of Anchorage, and they have their own food safety and sanitation program. They look at retail and food service as well as pools and spas, and they have other duties as well. There are many aspects to administering the food safety program. We have a lot of different sort of sub-programs within our program. We not only do retail and food service, but we also have a robust manufactured food program. As you can imagine, seafood is our bread and butter. Most of our processors are seafood processors. We also administer the mollusk and shellfish sanitation program, and we inspect body art and pool and spas outside of the municipality of Anchorage. You can see that I don't have a lot of staff. I have a small but mighty group of folks. We have a total of 30 within the program, including me. About 13 of those, when we're fully staffed, carry a full-time inspection workload, but they are also responsible for maintaining their offices. And as you can see in many of our offices, they're single-person offices. So they do it all, down to picking up the mail at the post office. We have some environmental health technicians who can do some sorts of inspections, but who are often rather busy with their their technician duties within the office, excuse me. All of our staff, all of our inspection staff are capable of reviewing plans. They issue permits, they provide technical assistance and customer service as well to those people who walk in. To give you a little bit of a picture of sort of the jurisdiction and sort of just the size and geography of our state and some of our challenges, the Fairbanks office, which is shown in yellow here in the map, they cover an area that's larger than the states of Texas and Virginia, which is really significant, as you can imagine. The Anchorage office, their jurisdiction is about the size of New Mexico. The Soldotna office, which is shown in sort of that sage green, kind of near on the Kenai Peninsula there, their area is about the size of West Virginia. And they have a lot of road to cover, as do the Wasilla and the Fairbanks offices. Next slide, please. So I'd like to tell you a little bit about our virtual inspection. We call it an assessment, and tell you a little bit about what that entailed. We had a phenomenal group of staff who developed the protocol, who developed the scripts, the helper forms, the inspection form, and I just can't say enough good things about them. They're just truly amazing. We prioritized the firms for which we would attempt to do virtual assessment. We prioritized, of course, complaints. Foodborne illness investigations are always our highest priority. And if there was any possibility of us being able to get out in person, we would have done that. Fortunately, we didn't have any major outbreaks during that time. But high and medium risk facilities are definitely on our priority list. As well, we thought this was a great opportunity for pre-operational assessments, and of course for changes of ownership or those firms that are never inspected. So we're not able, in spite of our best efforts, we're not able to inspect facilities near as often as we'd like. So we have not prioritized low risk establishments like mobiles for any frequency of inspection. They are inspected on a complaint only basis. So this was a bit of an opportunity for us to branch out a little bit. So the team produced some talking points that the environmental health officer could use to speak with the manager, the person in charge. And this was a voluntary type program. So someone could certainly opt out, and that was totally okay. If they accepted and said, yes, I'll go ahead and try it, then they used their talking points to describe what the inspection was going to entail. And then they sent them an email prior to going out and actually, or prior to setting up the assessment and doing it. And they sent them a self-assessment checklist and asked them to fill it out on their own. They were not required to send that back to us. This was just to prepare them for the upcoming assessment. If they said, no, thanks, I'm not interested, then we utilize that opportunity to update our information in our database, review what they're producing or they're serving on their menus, to discuss some general control and sanitation procedures. And then we just made a notation in a different area of our database to indicate that they weren't interested, but we did provide that technical assistance. Next slide, please. So some of the things that we talked about and we focused on during these short assessments, they were typically 15 to 20 minutes. As other speakers have mentioned, these you can't very well spend a half hour, 45 minutes on these assessments. We really had to make it count. And so they would focus on things like whether they had a certified food protection manager. In Alaska, we don't require one on every shift, but we do require that a knowledgeable person be on staff at all times. And we also asked about food worker cards. That's a requirement in our state that every food worker have a food worker card. We issue those cards. If they kept any logs, we would ask them about those and talk with them about those. We would really focus in, of course, on employee health, especially during COVID, even though we were not the primary agency to go out and enforce any of the COVID restrictions that were in place during this time. We also talked with them about bare hand contact, any sanitizers that they had, and talked with them about their thermometers, had them show them off to us and that type of thing. It was a pretty straightforward approach. And after this was all wrapped up, we, of course, sent them a follow-up email thanking them, providing them with a separate report, and then following up with any handouts or educational materials that we have to support those risk factors and active managerial control. So I wanted to talk, next slide, please. I wanted to talk next about our pros and cons, as some of the other speakers have done. In talking to the staff, they felt like this was a great chance to connect with operators, particularly those operators that we might not see all the time. This was also a truly risk-focused inspection. We follow and have a protocol for risk-focused inspection, but of course, it's really tempting to look at things that are not risk factors and get distracted sometimes. So this was just an opportunity to really focus in on those things that are absolutely critical. They, as well as Doug described, they felt like the operators were more at ease. Of course, it was a voluntary assessment that was going on. And it was they had the generally very positive interactions. For us in Alaska, travel time is significant and it's difficult to go from one inspection to another, sometimes even when they are in the road system. So this was great for folks to be able to not have those intensive travel requirements and the delays that are inevitable in Alaska. It was really quick for operators, only 15 or 20 minutes. So they really appreciated that. And one of the things that people really were interested in, our staff, was that they learned about new operators, or new operations rather, within permitted establishments. As you know, when we look at them during plan review, sometimes the next time we're able to look at them, they've expanded a little bit. And maybe we're not exactly aware of everything that they're doing, and it might even kick them into a different type of permit. Or have different kinds of requirements. One of the other things that was really striking, and I don't want to embarrass anyone, but part of our protocol, it dictates that we ask the operators to take temperatures and to check sanitizers as part of our review. And I think sometimes people, they mentioned that they get in the habit of doing that themselves, as opposed to asking the operators to do it. And so this was really great for them to be able to actually see that the operator knew how to do those things and could do them correctly. And that was something that a lot of them are taking forward, even when they go back and do virtual assessments again. So I thought that was really a high point. On the con side, as is demonstrated in Alaska today, sometimes technology is fussy. So I guess I'll just leave it at that. You know, I couldn't get on my internet. My internet just completely shut down. And that's something that we have to deal with. And the connectivity is pretty decent throughout the state, but it's not perfect by any stretch. And so not everybody has good internet access. They might not even have the appropriate equipment to be able to facilitate this type of assessment. Tech savviness can be a challenge. Sometimes people can have the technology, but not quite know how to use it. So there was a little bit of a learning curve, probably on both sides. We have varying degrees of a tech savvy in the state and throughout our EHOs as well. They did say that it was frustrating sometimes to have a limited time frame to make the observations. And one of the biggest things is that the conditions that you see while you're there are not necessarily always what they seem. Of course, the operator is showing you what you're asking for, but they're definitely, you have a limited screen where you can see things that are going on. And I think Doug touched on that quite a bit. Next slide, please. That might be it. So where do we go from here? So one of the things that I think that we all agreed about here was that this isn't a regulatory, we didn't use this as a regulatory tool, but this was, I think overall, the staff who were able to perform these virtual assessments really found a lot of positive aspects of them. And I mentioned what those positive aspects were. So in particular, they really saw the value with pre-operational inspections, which frankly, we don't always have the time to do, or the facility is opening in a place where we'd have to fly in. And so we may not be able to prioritize that type of thing. So it's great to get people set up. And of course, as you know, what's in the plan review isn't always necessarily what you see when you go to do your pre-op inspection. So we do plan to continue moving forward. You might have read in the news that Alaska is number 3, unfortunately, in the nation in terms of rates of COVID. So we're a bit on a bit of a self-imposed lockdown, if you will. We just were notified by our major hospital in Anchorage that they're in crisis mode for standard of care, and that's pretty significant. The beds are so limited and the staff are just stretched. So we will be picking these up again and moving forward. They will probably continue to be non-regulatory type inspections. And I'm sorry, I have a whiner in the background. That's my dog, my puppy. So with that, I know I probably went over a little bit of the time that I planned to speak, but I hope that you've learned a little bit about Alaska and our experience with virtual inspections, and I'm happy to answer any questions if you have them.
Okay, thank you, Kim. Katie, we're at time. Do we have time for one question, or should we just have them answer the question, have this panelist answer the questions in the chat?
I think it's just one question. Let's do it.
Okay, this question is for Teresa. Do you see virtual inspections playing a role for following up on corrections or otherwise supporting traditional on-site inspections without the need for travel or geographically large agencies?
Yeah, I think what we learned from this is that we can, use them for specific things. I found that the follow-up rates got better for people who especially have to drive 6 hours, back somewhere to, follow up. Our follow-up rates improved when we could do them virtually. I think there's a value added benefit. We usually take a lot of photos, emails, written attestations, those kinds of things. And just so you know, I saved a ton of money during the pandemic and not having people drive around. That money can go to, improving training and improving equipment, which is what we're doing now. All of this managed to prove to our administration that phones are absolutely indispensable for us to be able to do our jobs, and that we are far more efficient with them. So I do believe it has a place. And I do think that it can help reduce travel, but travel will never be off the plate, totally off the table for us. So until technology can improve to not shut down when you go into a walk-in cooler like that.
Thank you, Teresa. There was one other question. The question is there any data available on how many regulatory agencies are currently conducting virtual inspections? I'm not aware of any database that has that. If anybody is aware of something, please feel free to put that in the chat. And lastly, I just want to thank Kim, Teresa, and Doug for providing your jurisdiction's perspective on virtual inspections. I'm sure that jurisdictions throughout the country can relate to your experiences with these inspections, and it's certainly going to be interesting to see how things evolve over the next, who knows how long this is going to last. So thank you for all the work you guys do. It's very well appreciated, even though you guys don't always hear it.
Thank you. Thank you, Diane.